My name is Miao. I am the Digital Health Clinical Lead for Doctor2Go. My background is I'm a registered nurse. I have been working as a registered nurse for the last 12 years in New Zealand, Australia, and the Middle East. In the recent years, I have turned my attention into innovation and improving the access to healthcare by integrating digital health tools and primary care services. So I have a special interest in helping those members in the community that are having difficult time access to the healthcare, or those members in the community, they are just too busy to see a doctor when they should have. So I have been involved in the Doctor2Go project since the beginning, and I am in a digital health lead role since 2017. Doctor2Go is a private platform that giving you the access to the doctors, nurses, clinical psychologists, or the mental health professionals that you need. So instead of waiting in the waiting room for 2 hours in emergency, or when you call your GP, they are not available, or you're stuck in the traffic for a few hours, now you can have the access to the healthcare professionals with just one click immediately. So I believe this is the future. I can see some trend and changes over the years. In the past, in the very old days, doctors do house calls, so they visit the patients in their home when they're sick. So these days is we make an appointment with our doctors and we go to see a doctor in their office. But I believe it is the future that we should be able to access to the healthcare professionals through a digital platform immediately. Challenges, okay. I guess everyone has challenges. I just don't think my challenges are particularly more difficult than everybody else's challenges. I did move to New Zealand 15 years ago to study. That was a long time ago. And I did not speak any English at the time, so I have to start with learn English. And I put myself into university and I worked really hard to establish a professional career in New Zealand and other countries. Are the journey easy? Absolutely not. It was difficult, but I guess I just didn't think any of it. I don't feel those are the barrier to achieve what I want to achieve. And I just get on with it and do it. And I feel like it is really important to actually surround yourself with a group of people that are like-minded and you share the same goal and you work through the issues and find a solution. One of the best advice from the mentor is to believe in yourself and to be yourself. Especially there are times that nobody else believes in you and you still have to believe in yourself. Have a faith, basically. So I would like to take this opportunity to say thank you to my mentor. She is a retired professor. She was the CFO of a small business media company, which is later on bought by Murdoch's. So, and she has been involved in lots of healthcare education, economics, and she has started a foundation that helping those young people that in the startup companies and those students that sort of gone halfway through their degree but didn't financially not be able to support themselves to finish the degree. So I would like to acknowledge that my mentor that has been giving me so much courage throughout the years and to believe in myself. I think there's lots of challenges in health tech industry, but through our experience, I feel like one of the biggest challenges is the matter of how to teach the patient, the clients, and the people to change their behavior to utilize those services and those products that's available for them. So I believe now we have the sort of this product to support you, but it's a matter of how to utilize it. And this change can take a long time. I believe New Zealand is a country that's dynamic enough to adapt the change through the sense of our community, our can-do attitude, and I think over the time we will achieve that. 3-word advice. Well, it would be believe in yourself and be yourself and think bigger.